How skin needling works. We have all injured ourselves in one way or another in the past, and probably noticed how the wound or injury heals very quickly, usually leaving stronger tissue than before. This is the body's own healing mechanism, creating new collagen to repair itself. Just like in the intradermal needling technique, this intricate process is the basis behind microneedling therapy or MNT. We are creating the smallest of injuries to the face and letting our body do what it does best and heal the wounds. The only difference with a dermal roller or dermal pen and an acupuncture needle is that by the time we have completed an MNT treatment, we have created over 2,000 minuscule injuries that instantly begin to repair and rejuvenate. This repair and renew process is what makes MNT such an exciting development in natural cosmetic treatments. Combine the effect of the small injuries to the face with the ability to introduce high quality moisturizers and serums to the lower layer of the dermis of the skin, and you have an all round facial treatment that will provide impressive results. Due to the increased collagen production, the effects will continue to improve in the weeks and months after the treatment. Many people have asked to provide comparisons with MNT and other facial procedures. MNT is considered to be a non-ablative treatment that provides the same results as ablative treatments such as microdermabrasion and chemical peels. Benefits include rejuvenating aging skin and diminishing the appearance of common skin conditions such as indented scars, large pores, and or uneven skin tone, but the method involved is different. As opposed to ablative laser treatments, the epidermis remains intact and is not damaged. The aim of this type of treatment is to induce new collagen production without the need to remove this outer layer of skin. The topmost layer of the epidermis is known as the stratum corneum. It was viewed for many years as a dead layer of skin, but its intrinsic role as a barrier against dehydration, foreign bodies, and UV radiation are now well established. Continued basic science and clinical research, coupled with keen clinical observation, has led to more recent recognition and general acceptance that the stratum corneum completes many vital barrier tasks, including but not limited to regulating epidermal water content and the magnitude of water loss, mitigating exogenous oxidants that can damage components of skin via an innate antioxidant system, preventing or limiting cutaneous infection via multiple antimicrobial peptides, responding via innate immune mechanisms to cutaneous invaders of many origins, including microbes, true allergens, and other antigens, and protecting its neighboring cutaneous cells and structures that lie beneath from damaging effects of ultraviolet radiation. It is clear that it is preferable for this layer of skin to remain intact, which is not the case in ablative therapies, which moot out fine lines and scars by removing the epidermis and injuring the dermis. The downside is that these more invasive techniques result in a thinner epidermis being formed with less protection than before. This means that the skin is more vulnerable to the factors that lead to the reduction of collagen originally. There is, of course, a place for ablative treatment such as for hyperpigmentation, tattoo removal, and acne reduction. Although skin needling is a more effective way of reducing scars and treating aging skin, MNT is particularly effective for improving acne scarring. Overall, 36 out of the total of 37 patients completed the treatment schedule and were evaluated for its efficacy. Out of these 36 patients, 34 achieved a reduction in the severity of their scarring by 1 or 2 grades. More than 80% of patients assessed their treatment as excellent on a 10-point scale. No significant adverse effects were noted in any patient. Collagen is produced in the dermis at various stages of the healing process and continues to be laid down in the weeks and months ahead. This natural process has the effect of plumping out facial scars and fine lines and wrinkles, as well as helping to shrink the pores. This all occurs without damaging the protective barrier of the outer layer of skin, making it a preferable cosmetic procedure to more invasive methods. The second key benefit of microneedle therapy is the dramatic increase in absorption of topically applied creams. The microneedles temporarily open up minuscule channels, allowing serums and creams to bypass the barrier properties of the stratum corneum and penetrate to the underlying dermis. This is one of the main advantages of the treatment. However, it greatly demonstrates why we need to ensure the use of only high-quality professional topical products following needling, whether for MNT or ACULIFT. Thank you very much for listening.